Good day and welcome to today's DPI update, today being November 18, 2020. As usual, we have Minister of Health, Honorable Dr. Frank Anthony. Welcome again to the program, Dr. Anthony. And we want to start off by talking about the school situation, especially as it relates to the dormitories, which obviously have opened in a number of areas. And ever since the reopening of schools, there were some concerns about some students and now some teachers testing positive. Can you just give us an update on what the Ministry of Health has been doing and whether or not you have a clear handle on the situation?
Well, thank you very much for having me on the program. And I think that's a very important question. As you know, with the reopening of schools, one of the decisions that were taken both by the Ministry of Education and the Ministry of Health was to test those persons who would be coming into the dorms, because you wanted to make sure that everybody who would be living in the dorms would be free of COVID. And because they were coming from different places, we weren't sure of their status. So the important thing was, once they get into the dorms, to test everyone, and also to test the persons who would be working along with them, teachers included. As we started that exercise, we found that there were a number of cases, for example, at President's College. But then, the regional task force that we have, as they've been testing in other dormitories, we have found positive cases. Once we identify a positive child, there are two options. If they came in from very far away, their parents were informed, so that the team in that location can do contact tracing and inform those persons who might have been in contact with that child. And of course, to inform the family about the status of the child. That child, if they couldn't go back home, because let's say they're from the interior, we then provided facilities, and in the case of Region 4, we have been able to bring them to the Diamond Isolation Facility, where they would stay for the duration of 10 days. Most of the cases that we have identified so far with students, they're all mild cases, well, not even mild, but asymptomatic cases, because mild would imply that they have some fever or some other signs or symptoms. All the cases that we've had so far are really asymptomatic, and we only knew that they were positive because we actually did the PCR tests. And so we are monitoring. There are a few students who their parents have opted to take them back home, and we have allowed for that, because in our discussions with those parents, we have given them the option of either the child going to an institutional isolation facility, or they can go back home and, of course, observe the guidelines that we have given to them. So I think since we have started this exercise, we've had, I would say, about 32 children that we've identified, but they've all been looked after, and they're all being monitored.
Obviously, because it's a school situation, the ministry, another ministry is involved, the Ministry of Education. What has been the relationship like, and how have the two ministries been able to work together to not only ease the situation with the students, but also parents and teachers, because there are other players or other actors involved in this whole scenario, so to speak, in more than one region? How has that been?
I think the Minister of Education has been very proactive. She has gone out and met with parents, met with teachers, and explained to them some of the things that they need to do and what are the options that they have. So I think those things are made very clear to both teachers and parents and the students, because in some of these meetings I've seen students attending them. So I think everyone understands the guidelines, and that's what we're working with. On the Ministry of Health side, we have provided minimum guidelines to follow, and we have also, on the technical side, when there's a test that you need to do a PCR test, for example, our technical team would come in and be able to provide that support. And if there are any other technical advice in terms of discharges or isolation or any of those things, then our team is at hand to lend that support. So it has been a very collaborative experience, not only centrally between the two ministries, but also at the regional level, because in every region we have regional education officers, you have regional health officers, so they have been collaborating at that level as well. And in each of the region, there's a regional COVID-19 task force. So again, with the inputs of the REO, the chairpersons of those regions, these technical officers, they're all working together to ensure that our schools and the children and teachers who are working in those environments remain safe. So, with a pandemic, you will expect that there are people who are going to be positive. But like we have seen in other parts of the world, children generally are asymptomatic, and they will have a milder form of the disease. And so we expect that when we test the population that we would have been able to find a few positives.
Let's move on then, Minister, to the situation again in Region 1. And we know that you have talked about a success story in Quibana and the lockdown that took place there, which then resulted in a reduction in the number of cases. But there's an apparently growing situation, or a situation of concern, I should say, in the Warapoca village community. So what is happening there? And as of recent news coverage, the Tushao, I believe, is calling for a lockdown. Are we at that stage, or what is the ministry's response right now in terms of the number of cases and also perhaps the call for a lockdown?
Well, again, we have been collaborating with the village council, and our medical team has been in there almost more than a week now, and they have been engaging the village council, engaging the villagers, talking to them, explaining to them about COVID-19 and the precautions that they need to take. We identify initially 10 cases, and then after some extensive swabbing, we were able to get about 8 more cases. So currently we have about 18 active cases in Warapoca, and we continue to monitor that situation. The health team at this point in time does not believe that lockdown is necessary, but things can change. And as we swab, and if we find more persons who are positive and things like that, then maybe a decision would be made. But as of now, the health team is not recommending a lockdown, and we continue to work with the residents and the village council to ensure that they abide by the precautions. I understand also that as part of the health response, that we also sent in a sanitization team who, they went house to house working with people, explaining the precautions that they needed to take and so forth. And they have completed, I think, more than 44 different residents in that area. And they're going to continue to do that type of work. So let's see how these preventative measures work. And then if it's necessary, we would have this discussion with the village council and then be able to make a firm decision. But as of now, the health team does not believe that it's necessary to have a lockdown.
Another remote community, this time in Region 4, St. Cuthbert's Mission. Obviously, that has resulted in some heightened ministry response and regional response as well. What is going on now? Has the situation been improving since the lockdown? Let's talk about St. Cuthbert's Mission.
Well, at the peak, I would say we had about 269 cases, and over the last 2 days we have been doing some discharges because we've been monitoring people for a while now. And so, as of today, I think the cases have dropped to about 157. So, yeah, I mean, we constantly monitor, and once people remain asymptomatic for 10 days, then we discharge them. So we have been seeing that a lot of people would have met the 10-day requirement and remain asymptomatic, and so we have discharged them. We no longer consider them to be active. And for the other cases, we continue to monitor. We have a lockdown because of the amount of cases that we were seeing. The medical team in there is going to continue to do swabbing in some areas of the village. And we have the support of the joint services who have been assisting us with the lockdown. But it's not only assisting us with the lockdown. Through the CDC, we have been able to provide some additional hampers because we recognize that when people are at home and they're not able to work, the economic hardships that the community would face, the residents would face, and therefore we want to make sure that they are able to get some form of relief. So we have done that the week before and this week again. We have offered some support. So hopefully by sometime next week, we will see these numbers drop even more. And like Quibana, we will be able to lift the lockdown measures.
Generally speaking, Minister, what has been the feedback from residents when health officials, members of the HEOC task force, and even regional officials in your interactions with residents on the ground? Have they been supportive? Are they conscious of the need to follow the guidelines? What's the feedback coming to the ministry?
I would say it's mixed. There are some people who would readily take the precautions, understand that it's absolutely important to abide by these regulations and so forth. And then there's another group of people who, while they understand that these things are important, many of them are not in compliance, and that can create problem for everyone. So it's a constant thing where we have to educate people because while they might have, the awareness of how this thing is transmitted and so forth, it is how you internalize that and make sure that you behave appropriately. And sometimes we don't get that transition from the knowledge that you have to using that knowledge to behave appropriately so that you can stay safe. So it's something that we have been working on, but I think with the collaboration of members of the village council and other key influential people in the community, those sentiments can be turned around. And we are happy to say that, in most of the communities that we have worked with, in some cases initially we get a little bit of resistance, but then eventually I think people realize the seriousness of the disease and they collaborate with us and we are able to bring it under control. So I guess the teams that have been working in various communities are acquiring some level of experience now in doing this, but we can't be complacent, and we don't have to wait until you have a spike for us to behave appropriately. If we behave appropriately in the first place, we'll prevent spikes from happening.
I was going to ask you about challenges in remote communities like these, but you have partially answered that. But any other challenges in working or that the ministry is facing in working in these remote communities, not just Region 4, but elsewhere, because you've had many instances when you've had to increase presence of health officials, regional officials, and all that. Does the ministry have the capacity, and has it been done elsewhere, and what are your success stories?
So basically what we have the regular health network in different regions, right? In the hinterland region, because of the vastness of the territory and sparse population centers, sometimes it's difficult to adequately monitor in these areas. But once we go into these villages and we find that they are positive people, we spend more time, more attention to be able to identify these positive cases and to work with them. And if we believe that we need to leave medical personnel there, then we would get an appropriate medical person to remain in that particular village and to work with the villagers. Sometimes what happens to our system is if we have several areas that we have to monitor, then it can easily pose a challenge to the system. In those cases, the RHOs would ask for additional assistance, and we would then take other doctors and nurses from various departments within the ministry, and we would send them into those communities. So they'll spend a 2-week stint, 3-week stint, longer if it's necessary, and once the situation comes under control, then they would be, returning back to Region 4. So it's an ongoing exercise where if there's support that is needed somewhere, we have rapid response teams that we can deploy, and I guess that's how we have to operate for now.
We've dealt a lot with the ministry's response in a reactive nature to many of the instances of COVID-19 increases in many villages. Perhaps let's end on a more proactive note. Some time ago, you visited the Diamond Hospital and the Smart Upgrade program, which is, I believe, funded by the UK government. Diamond was the first such institution or facility to benefit. What's going on and what time frame are we looking for completion?
Well, my understanding is that we're almost nearing the completion of the facility. I think in the area where the x-rays are supposed to go, they are now putting some finishing touches in that area. But by and large, most of the work has been completed. I'm expecting that we will be able to get back the facility before the contractual time. Because this construction was slated to be completed by May next year. Fortunately, the contractor has worked overtime, and they have assured me that they can hand over the facility sometime in December. So we are very pleased about that, because we would now be able to return the facility back to service and to provide the health care that the residents of the East Bank of Demerara would certainly need. So I would expect that sometime in December that we'll be able to reopen the Diamond Hospital, and of course the facility would be much more enhanced.
But the facility has been in use to some extent while the...
Yes, there have been some limited use, because we continue to operate the maternity section of the hospital. But, we want the full thing to be operational, given the population size that we have to serve there. So we had impressed upon the contractor to accelerate finishing off the hospital, because it's important that we return services as soon as possible. So I'm happy that, we are going to get it back in December.
But I suppose it's one of the few projects that will be finishing ahead of schedule. What is the next one in line, and does that mean that starts ahead of schedule too?
Well, I hope that this give other contractors the benchmark or a standard by which to work with, so that other projects we can get them also finishing ahead of time. The next one that we're looking at is the Lenora Hospital. And already preliminary works in terms of relocating services and so have started. And we would start the physical construction very shortly. And after that, we have Mabaruma, Lethem, and of course, Paramakatoy. At Lethem, while we would be also redoing the actual hospital, we have started construction in September of a maternal waiting home. This is a home where mothers from around the region would be able to come to that facility and give birth. So that's going to help to improve maternal health in the region. We expect to see a decline in maternal mortality because there would be, a proper space to deliver these children. And of course, the facility would be much enhanced with the types of equipment and of course personnel to do those deliveries. So that too, we are hoping that by sometime in December, we will be able to complete that project. And again, ahead of schedule, hopefully. So, the people of Lethem can benefit from that service as well.
Minister, thank you very much for your time, not only today, but in general, for the time and energy you spend updating the country on the nation's response to COVID-19. And in closing, reminding our viewers and listeners that we were speaking with Minister of Health, Honorable Dr. Frank Anthony, on today's DPI update dated November 18, 2020.